We're staying on the cholera outbreak in Lagos State. The state government has activated a public health emergency operations center at Mainland Hospital, Yaba. The emergency operations center is expected to address the increasing number of severe gastroenteritis cases across multiple local government areas of the state. Lagos State now has 350 suspected cases of cholera in 29 wards across multiple local governments, with 17 confirmed cases. The State Commissioner for Health, Professor Akin Abayomi, disclosed that although this is an increase from the numbers published 4 days ago, cases are now dramatically subsiding in previously affected local governments due to interventions and surveillance efforts. And former Director of Disease Control, Lagos State Ministry of Health, Dr. Erinosho, joins me on the news this hour. Good to have you join us.
Yeah, good afternoon. I'm former Director of Disease Control, Lagos State Ministry of Health, and also the former Director of Medical Service and Disease Control, Lagos State Primary Health Care Board. I'm now a private person, I'm a public health physician. Thank you.
All right, thank you so much, sir. The laboratory investigation and test results, we understand, has so far confirmed cholera subtype, I think it's O1. Tell us about this type of cholera and how it is transmitted.
Okay, thank you very much. We actually have two common subtypes of cholera. We have O1 and O139. The one that has been endemic in Nigeria and most of Africa is the O1 type, and it's a very virulent type that causes severe dehydration and even death, resulting from profuse watery diarrhea that we refer to as rice water stool, and occasionally vomiting. So it's characterized mainly by profuse diarrhea and severe vomiting that results in sudden dehydration and can cause collapse, shock, and death within a few hours. So the transmission, basically, we have about 4 sources of transmission. The first one is through contaminated water. When water is contaminated with the diseases carried to the cholera, then it can be disseminated and transmitted that way when other people ingest. It's a oral infection, actually. That means it comes from mouth, passes out through the body in form of inside the watery stool. Then when water is contaminated and another person drinks that water, then the person can get infected. Also, the contaminated water can also be used to prepare food. And if the food is not thoroughly cooked, you can also ingest the food and get cholera. Then apart from this, that is when you have cholera sources in the environment, whereby the person continues to excrete Vibrio cholera in stool. Vibrio cholera is also a natural, they have their own natural habitat. And they naturally occur in brackish or marine areas, waters. And they are commonly found in seafoods such as crab, shrimps, and crayfish. That's their natural environment. So that means if someone eats the seafood raw or poorly cooked, the person can also get infected. So these are the common sources of infection or transmission of cholera. Contaminated food.
Quite interesting, water. Dr. Eniola. Apologies for jumping in, because you sort of put it into perspective. I'm sure a lot of people will be wondering, how did it spread in Lagos? But now that it is in, I think that we have 17 confirmed cases and several local governments. What precautionary measures should people be taking?
Okay, let me start with what I know that the state government has done, because they have done a lot, both the state government, the Nigerian Center for Disease Control, and also the partners, especially WHO and UNICEF. So what they have done is to activate the Emergency Operations Center in Yaba. I'm very aware of that. And they have also been doing risk communication strategies, passing information across to the community, releasing fact sheets on how it can be contacted and how it can be prevented, and what they need to do if there's any suspected case. Also, the government is also involved in active case search. Both the state government and the federal government, they are involved in active case search. And they also, just like you mentioned, they have conducted laboratory diagnosis, that's laboratory tests. 17 have been confirmed to be cholera out of the 350 cases we have in Lagos State, and 15 deaths have been recorded based on laboratory diagnosis. They are also involved in case management. That means cases are being managed at mainland hospital and other hospitals. Last suit is ready, and we have read a lot about that they are prepared and they are handling cases. We also have a provision of response materials. Like Lagos State government have actually supplied almost every public facility and private that are used as the first line treatment.
Dr. Erinosho, apologies for jumping in again. Just because of time, I have like 30 seconds, 1 minute left. I just wanted to quickly tell people what precautionary measures they should be taking.
Okay, now, what people should do, basically, is that make sure you drink clean water. And if you look at the sources of water contamination, water can be contaminated at the source where you are fetching the water, maybe from the pipe or from the well. Then also when you are transporting and when you are storing. What is important is that we must boil our water. And also, we can also add chlorine to water. That will sterilize the water and make it clean. And we ensure that we eat food that is well cooked. Don't eat raw foods. And again, it's better that we eat our food hot. Don't usually leave cold food. Then cover the foods in the houses, because flies too can move the vibrio cholera from feces to food. But most importantly, what we need to do is regular hand washing with clean water and soap. That is very crucial. But if you don't have access to clean water and soap, then you can use sanitizer. Then again, the environmental sanitation, that should not be open defecation. That is something that Lagos State government is struggling to ensure that we don't have open defecation in the state. Because when you defecate and there's fish everywhere and there's water and there's drain, just like we have now, the flood can actually seep into the wells in areas where they use well.
And that could also become a source of transmission. I'm afraid we do have to leave it there. Thank you so much for breaking it down for us in a way that everyone can understand. Former Director of Disease Control, Lagos State Ministry of Health, and former Director of Medical Services and Disease Control, Lagos State Primary Healthcare Board, Dr. Erinosho.
Thank you.